welcome into Your Health, and we have with us again Dr. Tom Kincer, and we had a wonderful segment where we talked about things that everyone in our audience should know, and this segment is going to concentrate on prevention, taking care of yourself, seeing a family doctor, and what we can do at the beginning to keep ourselves healthy, because ultimately, Dr. Kincer, like Jack and I have always said, it's up to you to take care of yourself. And let's talk a little bit about this, because we have a real problem in our area and in our society.
We do. So you're exactly right, Virginia. The thing that we're really gifted with initially is our health.
Yes.
And no one is more responsible for your health than yourself. And unfortunately, as a family physician, I see people coming in all of the time who have lost their health because of unhealthy lifestyles. And that's the first place that we should concentrate on. The second place that we should concentrate on is what you can do at your physician's office to prevent diseases, immunizations and so forth. But let's start with healthy lifestyles. So what is it that we can do to prevent disease within ourselves? If we look right now at the most common causes of hospitalization and premature death, what we're going to see is that it's related to heart disease and stroke and some cancers. But when you look even further at what causes the heart disease, it's where we can make a huge impact. So causes of heart disease, number one, cigarette smoking. Number one. So obviously we push not to smoke. Don't ever get started, because nicotine is extremely addictive.
Yes.
And once you get addicted to it, it's extremely difficult to get off of it. But the effects of tobacco are so bad on the body, causing heart disease, strokes, lung problems, cancers, all kinds of cancers. The second thing that we can do is prevent diabetes, because diabetes is hugely linked to heart disease. The number one cause of diabetes, there's several different kinds, but the number one cause of diabetes is obesity and lack of activity. We measure something called a BMI, a body mass index, and it kind of takes your body weight and your height into proportion. And normally, a healthy person should have a BMI of about 25 to 26. Once you get over 30 on your BMI, we call that obesity. In the state of Alabama, over 40% of adults and over 30% of children are obese. That obesity is directly related to the diabetes that we see in the state. And we do have medicines to treat it, but it only treats most of it. It doesn't really treat the part that causes the heart disease or the damage to the nerves. So how do we go about preventing diabetes? Well, we have to look closely at our diet and our weight and our exercise. They're all linked together. We make very poor food choices.
Yes.
We do. Fast food is all around us. We all live a very hectic lifestyle.
True.
A lot of my patients that have diabetes, they get up in the morning, they leave the house, they stop by a fast food restaurant, they grab a biscuit and other things, juices, and there's usually as many calories in that breakfast that they get as they need for the entire day.
Wow.
And then for lunch, they run out and grab something fast food, and then at night, you see the children usually have soccer practice or other activities, and they run by and pick up more fast food.
That's true.
And so normally we need about 2,000 calories a day. But if you look at the average diet of people in Alabama, we're probably getting 3,500 to 4,000, more than twice of what we need. And we just keep getting bigger and bigger.
You can't burn it off.
And you can't.
No.
No, you can't burn it off.
Could you clarify one thing for me? When we get into this discussion all the time, Diet Coke as opposed to regular Coke. I am not a believer in Diet Coke, but am I on the right track?
Well,
I don't know.
If you look purely at calories, regular soft drinks, we won't just pick on Coke, but regular.
Or Pepsi or whatever.
Yeah, just any.
Just diet as opposed to regular.
Right. So the regular sodas have a lot of sugar, about 40 grams of sugar in it, which is a lot of sugar.
High, yeah.
And so that definitely attributes to the insulin resistance that we see in diabetes. You can make an argument, on the other hand, with the diet sodas that they contain these chemicals that possibly cause other problems. I've seen it said that it's linked to Alzheimer's or dementias or cancers. We don't have great data for that, but we do have some emerging data that may be. So what I usually see with people is that they'll get into drinking the diet sodas and they'll drink 6, 7, 8 a day.
Yes.
And I would say that 1 a day is fine.
Okay.
You know, but given a choice of calories or no calories, I would choose the diet drinks.
Okay. All right.
But either one of them, you should limit it.
Drink water.
Yes.
Oh yeah, water is
most definitely.
water is the purest thing you can do.
So predominantly, you're looking at diabetes, heart disease.
Stroke prevention.
Okay.
High blood pressure, smoking, and cholesterol. Now our cholesterol levels that cause the cholesterol plaques or buildup in the arteries is driven by two things. One is our genetics, because our livers make cholesterol, and we need cholesterol to line the nerves, to help with muscles and brain tissue. So all cholesterol is not bad.
That's right.
It's when you have excess, your body doesn't know what to do with it, and so it stores it in the blood vessels, which clogs up the blood vessels and causes the heart attack or stroke. So the genetic part is predetermined.
Right.
But that doesn't have as much to do with it as what we do with our diet.
Okay.
When we're eating a lot of these saturated fats, now there's two kinds of fats in general, saturated and unsaturated. Saturated fats are those that are solid at room temperature. Like if you ever fry bacon and you leave the pan out there, an hour later it is solid and white. Just imagine what that does in your arteries. Those are bad fats. Good fats are the liquid fats, and they actually help us metabolize other fats. So things like olive oil, peanut oil, that you can stick in the refrigerator and get it really cold and it still won't turn to solid. Those are good fats. You find those in avocados and nuts and olive oil, like I said. So we want those kind of fats, and we want to avoid the fats that are solid at room temperature. Butter, animal fats, whole milk are examples.
Okay. Well, we thank you so much for all the information. And later on in the year, we would love to have you back.
Sure, be glad
and
to.
go over more detailed things that our audience can hang on to create a better and healthier life, so that you live longer and you don't have to go to the doctor as often.
But do go get your annual checkups.
Absolutely.
Get your vaccines, and make sure that all of your blood pressure and your parameters, your sugar and everything is good. So at least once a year, go see your doctor.
Well, it's just like your car. You wouldn't run your car without oil, so why would you run your body without a checkup?
I agree.
Okay. Thank you so much, and stay with us, and we'll be right back.